So there's been a lot of headlines over the last few days like this one, this one, this one, and this one, whipping up yet more panic amongst people, especially parents the world over, getting the idea into people's heads that
random tube event
is now affecting young children. When in fact what they actually go on to mention in their very articles, Kawasaki disease, is the thing that we should be taking from these articles, as it is a serious illness that does kill children all over the world all the time. Yet in these alarmist articles it's only given a brief mention as some kind of mysterious disease that nobody knows anything about, when in reality it's a disease that's been known for decades and has been studied meticulously. In this video I'm just going to explain what I found out about Kawasaki disease by doing a quick Google search. I went on mayoclinic.org. Mayo Clinic is one of the United States' leading hospitals and has hundreds of references to Kawasaki disease. So not only is all this information very interesting, it could also save lives. Kawasaki disease causes swelling or inflammation in the walls of medium-sized arteries throughout the body. It primarily affects children. The inflammation tends to affect coronary arteries, which supply blood to the heart muscle. Kawasaki disease is sometimes called mucocutaneous lymph node syndrome because it also affects glands that swell during the infection, lymph nodes, skin and mucous membranes inside the mouth, nose and throat. Signs of Kawasaki disease, such as a high fever and peeling skin, can be frightening. The good news is that Kawasaki disease is usually treatable and most children recover from Kawasaki disease without serious problems. Symptoms. Kawasaki disease signs and symptoms usually appear in 3 phases. In the first phase, signs and symptoms of the first phase may include a fever that is often higher than 102 Fahrenheit, 102.2 Fahrenheit or 39 degrees Celsius, and that lasts more than 3 days. Extremely red eyes or conjunctivitis without a thick discharge, a rash on the main part of the body and in the genital area, red, dry, cracked lips, and an extremely red, swollen tongue, swollen red skin on the palms of the hands and the soles of the feet, swollen lymph nodes in the neck and perhaps elsewhere, and general irritability. In the second phase of the disease, your child may develop some of the following: peeling of the skin on the hands and feet, especially the tips of the fingers and toes, often in large sheets, joint pain, diarrhea, vomiting, and abdominal pain. In the third phase of the disease, signs and symptoms slowly go away unless complications develop. It may be as long as 8 weeks before energy levels seem to be back to normal again. So when do we need to see a doctor? If your child has a fever that lasts more than 3 days, contact your child's doctor. Also, see your child's doctor if your child has a fever along with 4 or more of the following signs and symptoms: redness in both eyes, a very red swollen tongue, redness of the palms or soles, skin peeling, a rash, or swollen lymph nodes. Very important to mention that treating Kawasaki disease within 10 days of when it began may greatly reduce the chances of lasting damage. Now, the causes, this is quite interesting. No one knows what causes Kawasaki disease, but scientists do believe that the disease is contagious from person to person. A number of theories link the disease to bacteria, viruses, or other environmental factors, but none has been proved. Certain genes may make your child more likely to get Kawasaki disease. So, risk factors. 3 things are known to increase your child's risk of developing Kawasaki disease. So the age: children under 5 years old are more at risk of Kawasaki disease. Sex: boys are slightly more likely than girls to develop Kawasaki disease. Ethnicity: now this is interesting again. Children of Asian or Pacific Island descent, such as Japanese or Korean, have higher rates of Kawasaki disease. So that would suggest the possibility of a genetic factor there. Complications: Kawasaki disease is a leading cause of acquired heart disease in children. So, however, with effective treatment, only a few children have lasting damages. So, Heart complications include inflammation of the blood vessels, usually the coronary arteries that supply blood to the heart, inflammation of the heart muscle, heart valve problems as well. Any of these complications can damage your child's heart. Inflammation of the coronary arteries can lead to weakening and bulging of the artery wall, so an aneurysm. Aneurysms increase the risk of blood clots, which could lead to a heart attack or cause life-threatening internal bleeding. For a very small percentage of children who develop artery problems, Kawasaki disease can cause death, even with treatment. Diagnosis. There is no specific test available to diagnose Kawasaki disease. Diagnosis involves ruling out other diseases that cause similar signs and symptoms, including scarlet fever, which is caused by streptococcal bacteria and results in fever, rash, chills, and sore throat, juvenile rheumatoid arthritis, Stevens-Johnson syndrome, a disorder of the mucous membranes, toxic shock syndrome, measles, certain tick-borne illnesses such as Rocky Mountain spotted fever. So these illnesses would have to be ruled out in order to diagnose Kawasaki fever. The doctor will do a physical examination and order blood and urine tests to help in the diagnosis. Tests may include blood tests. Blood tests help rule out the other diseases and check your child's blood cell count. A high white blood cell count and the presence of anemia and inflammation are signs of Kawasaki disease. Testing for a substance called B-type natriuretic peptide, BMP, that's released when the heart is under stress and may be helpful in diagnosing Kawasaki disease. However, more research is needed to confirm this finding. Electrocardiogram. Electrodes are attached to the skin to measure the electrical impulses of your child's heartbeats. Kawasaki disease can cause heart rhythm problems. And an echocardiogram. This test uses ultrasound images to show how well the heart is working and can help identify problems with coronary arteries. Treatment. So, to reduce the risk of complications, your child's doctor will want to begin treatment for Kawasaki disease as soon as possible, preferably while your child still has a fever. The goals of initial treatment are to lower the fever and inflammation and prevent heart damage. Treatment for Kawasaki disease may include gamma globulin, an immune protein, gamma globulin, through a vein intravenously, can lower the risk of coronary artery problems. Aspirin. High doses of aspirin may help inflammation. Aspirin can also decrease pain and joint inflammation, as well as reduce the fever. Kawasaki treatment is a rare exception to the rule that says aspirin shouldn't be given to children. Aspirin has been linked to Ray's syndrome, a rare but potentially life-threatening condition in children recovering from chickenpox or flu. Children should be given aspirin only under the supervision of a doctor. Because of the risk of serious complications, initial treatment for Kawasaki disease usually is given in a hospital. After the initial treatment, once the fever goes down, your child may need to take low-dose aspirin for at least 6 weeks and longer if he or she develops a coronary artery aneurysm. Aspirin helps prevent clotting, so that's why. However, if your child develops flu or chickenpox during treatment, he or she may need to stop taking aspirin. Taking aspirin has been linked to Ray's syndrome, a rare but potentially life-threatening condition that can affect the blood, liver, and brain of children and teenagers after a viral infection. With treatment, your child may start to improve soon after the first gamma globulin treatment. Without treatment, Kawasaki disease lasts an average of 12 days. However, heart complications may be longer lasting. So, monitoring heart problems. If your child has any signs of heart problems, the doctor may recommend follow-up tests to check your child's heart health at regular intervals, often at 6 to 8 weeks after the illness began, and then again after 6 months. If heart problems continue, you may be referred to a doctor who specialises in treating heart disease in children, a paediatric cardiologist. Treatment for heart complications related to Kawasaki disease depends on what type of heart condition is present. If a coronary artery aneurysm ruptures, treatment may include anticoagulant drugs, stent placement, or bypass surgery. Wait to vaccinate. If your child was given gamma globulin, it's a good idea to wait at least 11 months to get the chickenpox or measles vaccine, because gamma globulin can affect how well these vaccinations work. Coping and support, the next topic here. So it says, find out all you can about Kawasaki disease so that you can make informed choices with your child's healthcare team about treatment options. Most children with Kawasaki disease recover completely, though it may be a little while before your child is back to normal and not feeling so tired and irritable. The Kawasaki Disease Foundation offers trained support volunteers to families currently dealing with the disease. Preparing for your appointment. You'll probably first see your family doctor or paediatrician. However, in some cases, your child may also be referred to a doctor who specialises in treating children with heart conditions, a paediatric cardiologist. Because appointments can be brief and there's often a lot to discuss, it's a good idea to be well prepared. Here's some information to help you get ready for your appointment, as well as what you can expect from your child's doctor. So what you can do. Write down any signs and symptoms your child is experiencing, including any that might seem unrelated. Try to keep track of how your child's fever has been and how long it has lasted. Make a list of any medications, vitamins or supplements that your child is taking. Ask a family member or friend to join you if possible. Sometimes it can be difficult to remember all of the information provided to you during an appointment. Someone who accompanies you may remember something you missed or forgot. Write down questions to ask your doctor. Your time with your doctor may be limited, so preparing for a list of questions will help you make the most of your appointment. For Kawasaki disease, some basic questions to ask your child's doctor may include these. What's the most likely cause of my child's signs and symptoms? Are there any other possible causes for his signs and symptoms? Does my child need any tests? How long will the signs and symptoms last? What treatments are available and which do you recommend? What are the possible side effects of the treatments? Are there any steps I can take to make my child more comfortable? What signs or symptoms should I watch for that might indicate that he or she is getting worse? What's my child's long-term prognosis? Are there any brochures or other printed material that I can take home with me? What websites do you recommend visiting? In addition to the questions that you've prepared to ask your doctor, don't hesitate to ask any additional questions that may come up during your appointment. So what do you expect from your doctor? Well, your child's doctor is likely to ask you a number of questions. Being ready to answer them may reserve time to go over any points that you want to spend more time on. So your child's doctor may ask you the following. When did your child begin experiencing the symptoms? How severe are the signs and symptoms? How high has your child's fever been? How long did it last? What, if anything, seems to improve the symptoms? What, if anything, appears to worsen the symptoms? Has your child been exposed to any infectious diseases? Has your child been taking any medications? And does your child have any allergies?